5,000 pregnant women have had Zika here. A big concern, of course, because their babies may well be carrying this brain-damaging condition, microcephaly. And across the country, 31,000 people affected, added to Brazil's 1.5 million cases. And look, this really illustrates the problem that the authorities are up against. However hard they spray, there are huge areas affected with stagnant water like this. This is the breeding ground for the Aedes mosquito, the one that spreads Zika. At the moment it's just past midday. In the heat of the day the mosquitoes are hiding in the shade, but come the cool of the evening these mosquitoes will rise up and they will affect the people who are living close by. This is a compound where there are 19 people living and it's the dry season, so when the rains come in a few weeks' time, this water will rise and there are many mosquito eggs that have been laid and they will hatch very quickly and the mosquito numbers will just multiply. Now, because it's a dry season, people collect large quantities of water in buckets like this, and you can see that they try and cover some of them to stop the mosquitoes getting in and laying their eggs, and that is some way that they can help to reduce the number of mosquitoes around. But the housing here in La Maria, one poor district of Cartagena, you can see they're just shacks, unprotected. There are no mosquito netting on the windows, the doors, or indeed on the beds. And because it is so warm, people, particularly the children, aren't fully clothed. And despite the advice of the health authorities that they should cover up the skin as much as possible and use repellents, they clearly can't afford that kind of clothing, and it is likely to expose them to Zika. We have seen many cases of the diseases while we've been here in Colombia, and some of those have been pregnant women. It is a great worry that when the rains return in a few weeks' time, you're going to see an explosion in those numbers.